everybody, and thank you for taking time to join Gyan Pravah, the series started by our president, Dr. Tandulwadkar. One more evening with all of you. So today, I first of all obviously would thank Dr. Sunita Tandulwadkar. She's the president of the Federation of Obs and Gynec Societies of India. It's probably the most active medical organization in the world, I would say. And personally, we have been very inspired by the way that she has conducted this year so far, and with a great deal of passion and staying vulnerable and showing us all how she manages a lot of things together. And I personally feel very inspired as a woman. She's a great surgeon. She's been pioneering in the stem cell technologies in India, and also she's very good in leadership roles. So very inspired. Thank you, madam, for doing a lot for all of us. And today I welcome Dr. Alison Wright. Alison is a consultant obstetrician and gynecologist in London and has been the vice president of RCOG in the past. And she has led many global health projects, improving care for women and health around the world, developed RCOG Green Top guidelines, which are the crux for, you all know, MRCOG exams, and transform the services for the members. She has also been the National Specialty Advisor in the Obstetrics for NHS England, and has been leading the team at the HCA Portland Hospital in London. And she sits on the UK GMC, which is the General Medical Council, and also has been advising WHO and FIGO. So thank you for taking time to join all of us. Alison, would you like to say a few words before we begin, Dr. Tandulwadkar, and then I'll ask you, Alison, also.
Yes, thank you so much, Anu. And thank you. I agree with you completely about the inspiration from Dr. Sunita. Really, we are inspired by the webinars, the series that you've done, and the wide reach that you have. I've always been a friend of Fogsi. I'm delighted to be an honorary fellow. So yeah, it's a really special day for me to be with you here today. Thank you.
Thank you, Alison. I should say the same for you. It's such an honor that today you are on our Fogsi platform. This Gyan Pravah, our series of podcasts every day at 8 p.m. One of the chairperson with one of the faculty, it may be academic, non-academic, spiritual, philosopher, or someone who has achieved in the sports field or the politics. And it's a 45 minutes, a crisp podcast. 30 committee chairperson have been given 30 days. And on the same date, on same day, they will be there every month. It's an amazing way. I think they are taking their leadership, because these committee chairpersons are our future leaders of Fogsi. And I felt it's very important that they become confident and they can have a beautiful dialogues with. They can share the platform of Fogsi on their own without the shadow of Fogsi presidents or vice presidents. That's very important. Of course, they work with us in a lot of social projects. You know, you can go on a Fogsi website. We work like a crazy, 24/7. Of course, we do practice. We don't give up our practice. It's professional life, organizational life, and a family life. Tough to balance. 24 hours are not enough, but that's how it is 1 year. We enjoy it. And I'm so thankful that today we are going to have a great discussion, and I'm sure we'll have a lovely time. You are such an achiever, and I wish you all the best in whatever future endeavors you wish to. Thank you.
Thank you.
Thank you very much.
And congratulations, Anu, for selecting such a fantastic faculty.
Thank you. I really want to change the thought that we have that when women are not very aggressive, they can't be achieving the way, some other personalities can. And that is something very personally inspiring about Alison to me. Over the years, we have been, in touch for so many years now. So thank you very much.
Thank you.
I'll start with the podcast.
And as the protocol is, Alison, I will be joining from other link to listen to your great dialogues.
Thank you very much. So yes, Alison, so here we go. I would first ask you, basically starting from your own journey. So can you share a bit about your journey in the gynecology and what inspired to take a large chunk of your life to be given to the subject?
Yeah, it's a good question, Anu. So I always wanted to be a doctor. When I was young, I thought maybe psychiatry, and then I was thinking I wanted to be an orthopedic surgeon.
Oh,
Partly
wow.
because it's a male-dominated scene, I was thinking that would be great, and also I enjoy the surgical aspects. But actually, when I did obs and gynae as a student, I really thought, you know, there's such potential. I love speaking to people as well as surgery, and there's such potential to make a difference. I always had from my parents a value that not only do your job well, but make a difference to the wider world if you can. So my clinical interests, as you know, one of which is urogynecology. I think this is an area where women are often vulnerable. It's difficult to talk about, there's a lot of stigma, but we can really make a difference to women's lives. And the other issues are, of course, high-risk obstetrics, maternal medicine, where, again, if we really look at what are those socially and medically complex situations that we need to do something about, we can really make a difference on a wide scale. So, you know, from the woman in front of me every day to speaking about it now, that really is my passion.
Wonderful. So with the advancements of the technology, how do you see gynecology evolving in the near future, say 5 to 10 years from now?
Yeah, it's a good question. I mean, we're seeing yourselves in India as well as we here in the UK and around the world, the rise of robotic surgery, the rise of AI, which is all fascinating. And I think we need to really keep an eye on that. Some of my colleagues tell me that robotic surgery is really a game changer in terms of particularly endometriosis as well as women's cancer. I think, given your comments at the beginning about men and women, Anu, I think it's really interesting that it's actually more difficult to bring in robotic surgery for women than it is for men. And I think that's quite interesting, the way that it's been brought in quite easily for men as a pioneering service, whereas when it's for women, it seems that we have to put a business case together. So I think just the very fact of how people view things differently for men's and women's health is something we need to listen to. I think there's all sorts of things in AI. I think that could really benefit from us. We just have to be very careful as clinicians around the world that we together are leading the agenda. I was always speaking to the government when I was an advisor to the government to say, you know, these projects should be clinically driven, but tech-led. So we can use our clinical experience to say, this is what we need the technology to deliver, rather than the other way around. So I think AI, robotics, genomics will really transform our field in a very positive way for women's care. We just need to make sure that we and women themselves are careful that we have it still that the agenda is clinically driven rather than the other way around. So we want tech to enable clinicians to do our job better rather than the other way around.
Right. So the personalized maternity care is the key focus in your practice. How do you think it improves the patient-centered outcomes?
Yeah, it's interesting. We talk a lot about personalised care, and I think that's partly about making sure that we personalise care to the woman in terms of what she wants. And we often find that if women, and I know from speaking to colleagues in India, this is the same, if women do not trust us to do our best for them, they may not engage in our service, they might not come to a facility, they might not want to come to the hospital. We're seeing increasing in the UK, increasing numbers of women actually wanting to free birth without any midwives or obstetricians there because they don't trust us. So we have to do better in terms of personalising care, means listening to women and what matters to them. I think the other really important thing about personalised care is to use our experience and judgment as doctors. So guidelines are important. We mentioned the green line, the green top guidelines earlier as our guide, but we also need to then personalise that care to that individual, so that if we're looking at a CTG monitoring in labour, we're making sure we think about what's happening to that baby. And that's work that Tim Draycott and others have done with the ABC project in the UK. Really important that we think about not only what does that heart rate monitoring look like, but we personalise that to the woman. So does she have a chronic illness? Does she have a growth restricted baby? And therefore we personalize the care to that woman and baby. And we know that that's the way that we will achieve better outcomes. I mean, the other thing, as you know, Anu, in the UK, as well as around the world, we are still very challenged by racist behaviours, and there are still poorer outcomes for certain ethnic minorities, deprived backgrounds, which we really need to tackle. And again, we need to listen to women from those communities to say, what could we do different to personalise the care and to improve care for you, therefore for outcomes. So I think there's a lot we could do more in terms of personalised care, improving care for everybody.
And as a former vice president of the Royal College, what are the biggest challenges that even the college is facing, or in general facing women's health care? So at present, what is the agenda?
So looking at obstetrics and gynecology again globally around the world, because I think we're all facing similar challenges. I think one of the key things we need to do is to support doctors. So I think doctors are increasingly finding themselves in challenging situations under scrutiny, short-staffed, maternity services are in crisis. So I think the first thing we need to do is to support doctors, and this goes for elsewhere in the world. Speaking to doctors in India, Bangladesh, Pakistan, I know that doctors elsewhere in the world also are feeling quite vulnerable sometimes if there's a problem. So we need to provide support for doctors, otherwise we won't have a workforce in the future. And I think that brings us on to the workforce numbers. We know that around the world there is a shortage of doctors, especially in our specialty. So I think that's really important. And then one of the other challenges that I think we need to really be mindful of, again globally, is our lack of exposure to gynae surgery. And I know in India, I think you have more exposure to surgery, whereas things that, you know, we're talking about advances, some of the advances are in minimally invasive procedures, which are much better for patient care. But that does mean that our more junior colleagues don't have the exposure to the kind of pelvic surgery that we did when we were training. So I think that is going to be a key challenge and something which really needs to be addressed. You know, and there's lots of ways we can do that, looking at different models, looking at simulation and so on. But I think we definitely need to address training in gynae surgery.
And you have been very instrumental in that. You were the supervisor in my class. So that is something very important, very special memory. So there have been many technologies like minimal invasive surgery. And what is the role of all these technologies, do you think, that has transformed the action of from the side of the college and from the perspective of the patients? You have touched the training side of it already. So do you think that if we stick to the conventional side of the surgeries, it also goes in the favor of the whole system of medicine institutes, or how does the technology benefit the training and from the perspective of both? Because when we see, you just mentioned that in the terms of training, we were trained in a far higher number of pelvic surgeries. And because of the minimal invasive surgeries, that perspective is lost from the training point of view, but it's good for the patients. So where do you see the balance point?
Yeah, no, it's a really good question. It's a really pertinent issue, isn't it? I think one of the things is simulation. So there are a couple of clinical fellows at the moment at the RCOG who are looking at ways to be innovative in terms of gynae surgery. One of those is simulation, and there are other working groups looking at different ways. So I think that will be really exciting to see what they come up with over the next year. I think we do need to acknowledge that although minimally invasive procedures are great for patient care in terms of ambulatory, and I don't think we can go backwards now. You know, we've made such advances, but you know, in the same way that we need to get our skills up to scratch for say vaginal breech birth, I think it's probably going to be the same in terms of gynae surgery. You know, sometimes we hear people say, oh well, we should do more vaginal breech births so people keep their skills up. No, that's not fair on women or babies. We need to know how to do vaginal breech births to support those who want it. And I think in a similar way, we can't go backwards to do more open hysterectomies like you and I used to do. We have to go with the technology because it's better for patient care, but we need to look at innovations behind the scenes. One of those is simulation. One of those is using mentors. So, for example, very experienced people who would be willing to help to mentor and train younger colleagues. I think there are lots of ways that we could be innovative in using our senior colleagues' expertise in terms of training the juniors. But we need to do something, and I think we need to do something now so that we don't lose those skills for the future, because when our sisters and our relatives need surgery, we want someone who knows what they're doing, don't we?
Absolutely, yeah, of course. So, so I'm a fertility specialist. That's my area. So I can't miss the question related to my own zone. So what are your thoughts for the future of the fertility treatments and reproductive health related things that are happening in the UK?
Yeah, I think it's interesting, and respect to you, Anu, for the work, that pioneering work that you do. I think a lot of the challenge is in terms of access. We have a lot of issues in the UK in terms of access, and also in deciding who should access that healthcare. And it's still, as you know, it's still certainly a postcode lottery as to who can get that access to treatment. So I think that's one of the first things. I certainly see lots of women wanting to know about egg freezing. And I think that's something that it would be good for us all as international organisations to have a position on. Are we going to allow everyone to freeze their eggs? Are we going to encourage it? But I think we ought to, as obstetricians and gynecologists and fertility specialists, again, as I mentioned earlier, I think it's up to us to lead that agenda. We should be saying what our thoughts are. I mean, certainly, for younger women now, it seems very advantageous to be able to take the pressure off them and say that they can freeze their eggs. And I've certainly been very impressed by the technology of egg freezing, even in the last 5 years, how it's advanced. But I still think we need to just maybe take a step back sometimes and look at that technology and ensure that it's being clinically driven by us and by the women who we're serving.
Yeah, and rightly, as you mentioned, it's important to release a position so that the patients don't go to the lesser reputable sources online. So, yeah. So, yeah, and moving forward, so what are your thoughts for the future of fertility related work that needs to be done from the perspective of the International Federation, FIGO? And also you have worked on the safe motherhood side of the project related to FIGO. So what are the global lessons that can be applied to improve the care based on the projects that you've led and traveled extensively?
Yeah, it's interesting. I mean, I think it applies equally to fertility, to safe motherhood. I think the people who need to be making the decisions are obviously the women, and it's up to you and I to be amplifying their voice. There's an American saying that if you are not on the table, you might be on the menu. And I think that's really pertinent to us to say, I don't know if you've seen the film, The Menu, it's quite scary. They really were on the menu. But I think it's a really good saying because we need to be at the table. We obstetricians and gynecologists need to be sharp-elbowed about this. We need to say we need to be there at the policy-making table, whether that's about fertility or safe motherhood. The great thing about the FIGO project I'm leading on at the moment, it's Gates Foundation funded, and it's actually looking at leadership in obstetrics and gynecology. So going to different countries. So Rishikesh Pai, Dr. Sunita have been very helpful in this, instrumental personally, actually, both of them, in leading on this in India. We've been going to 6 different countries to speak to people, to speak to obs and gynae leaders, to say, what would make your job easier to do? So, if we're looking at PPH bundles, which is one of the domains, they might say, we need a fridge to store the drugs. They might say, I need to know who to call when I'm escalating. Very, very simple things. Or they might need procurement of tranexamic acid, etc. These are examples. But the project asks those people in leadership positions in obs and gynae, what would make it easier for you to follow international guidelines and provide good care? And people know, we know what needs to be done. And actually, to your point, I think that would be really, really good to do in the UK, to go to every hospital in the UK and say, okay, you're the clinical lead of this unit. What could we do to support you that would make you able to provide better care? Because people have the answers. You and I know that obs and gynae doctors, we know what we need to do, but we need to be asked that question and empowered. We need to be at the table. That's exactly what the FIGO LDI leadership program is about. And I think that it's been really effective globally. It would be great to replicate that in the UK.
Yeah. So when did you start this program, and how extensive is that, this LDI?
Yeah, so it's been running for 3 years. So we'll finish at the end of this year now. So it's in 6 countries, looking at 4 domains, looking at implementation of guidelines. So preterm labour is another one, anemia is another one, and preeclampsia is another one. And I mentioned PPH. So those 4 domains, looking at how we all know that there are guidelines existing. Now, I've spent lots of my life working on guidelines. Why don't people follow those guidelines? I think it's really interesting and very pertinent. You know, occasionally it's because people don't agree with the guideline. They might not like to say, they might be too shy. That's something important to talk about. But usually it's because people don't have either the resources or the training. And if they did have the resources and the training, they could provide that best care for women, which makes our job more satisfying and fulfilled if we can do that. So I think it's very pertinent to all of us to be asking those simple questions. What could we do to support you? What could FIGO, Fogsi, organisations do to support doctors to give better care? I think is fundamental.
So we're coming to nearly the close of the show, but 2 more questions.
Yeah.
So the first is, what advice would you want to give to the younger generation, the aspiring gynecologists who want to specialize in the high-risk obstetrics? We know the world has not been very kind to doctors lately. So how do you make life easy?
That's a good question. I wouldn't say necessarily mine has been easy, although very enjoyable. I think tenacity, so stick to what you know. Often these things are a long game. You know, the project I talked to you about, that had been in the making for many years before it got funding and then actually happened. So we do need to be tenacious. I think some advice that someone gave to me early on was make your ambitions known. And I think sometimes young doctors are quite shy to say, I'm interested in this, can I do this? So I, as a very young doctor, sought out somebody who was interested in maternal medicine. She was a professor, Catherine Nelson-Piercy in London. And I contacted her saying, can I spend some time with you as a leader of the field? And I think we need to be bold. I would give that advice to anyone starting. Have your ambitions, make sure your ambitions are known to those around you, and then they can support you and give you a leg up. as you and I do. Yeah.
Vision board accessible to all.
Exactly.
Finally, the key changes are, again, the policies. What would you like to see implemented in the gynec and maternity care in the near future if you had a free will? Lots. Made it twisted. So yeah, I know.
I think something that we still need to improve on, to be honest, is informed consent. It's now 10 years exactly since the Montgomery ruling, which means that it changed the way that we're supposed to counsel women. I know Nadine Montgomery, who had a very difficult birth, and we still need to do something to change that situation. I think we're getting much better at giving women choice, but I don't think we give people the information to make that choice. And that's about personalising care as well as having honest conversations with women. So I think that's something that we really need to change. So there's no point in just saying, you know, there's the labour ward, off you go, it's your choice. Because often women will not understand. I mean, some do, that's fine, but the majority will need a steer from us as doctors to say, this is the information, this is the evidence, this is my opinion, etc. So I think that's one thing. And the other thing really key is that we as obstetricians and gynecologists need to be at the table at every level, whether it's policy making, whether it's at government level, whether it's in our own hospital boards, making decisions. We need to be at the table for every key policy. And I think as we have done, you know, with Fogsi and FIGO and RCOG and other big organisations, there's a big power in getting together as obstetricians and gynecologists. We all have the same issues. You know, we all have doctors who are increasingly stressed out. We all have issues about short staffing. We're all looking at what's happening to the cesarean section rate and why. We have the same issues across the whole world. So I think what we need to do more of is build on those relationships, as we are, but I think we could do more to get together, and there's a bigger power in our combined voice.
Wonderful. Any plans to join the mainline politics?
Let's see what happens, Anu.
So wonderful. It was really nice to see know more insights, your thoughts on the keeping our track more or less central and not getting swayed like we usually have our other conversations. So thank you very much for joining all of us. I'm sure every audience is very pleased to know a perspective from somebody who has worked a long time in the college. So thank you very much, and best wishes for all your future ventures.
Thank you, Anu. Likewise, thank you.
Thank you.